Well, welcome everybody. I'm here with one of our favorite patients who had abdominoplasty surgery or tummy tuck surgery back in October. And we also did a little bit of liposuction and trying to give her just an improvement to her figure. And she has some impressive credentials, which I thought would be great for a little video like this so that she could tell others about the surgery. And I asked her to be bluntly honest. So please tell me what things that I could have done better and things that I missed, things that you wish you knew about beforehand, and things that you like about it too. And we'll really enjoy sharing this with other patients. So I'll let you speak.
I think for me, when I first came in, it's because I was frustrated with having that belly fat that I couldn't get rid of after exercising and having a whole life of fitness. And I thought it was about liposuction because I didn't know. I thought someone just goes in and kind of rotor-rooters it, and that would take care of the problem. And it really wasn't until I had that appointment where it was kind of a reality check of the way that my belly was lying. I had what I had described to you, if you remember at the time. I didn't have a belly button. I couldn't see it. It was like a frowny face on my abdomen. And I just wanted you to like pull it down and suck it out and take care of it. And that's when you were really good about, telling me it's going to be a little more to get the results you want because abdominoplasty, tummy tuck, which I'd always heard about tummy tucks. I wasn't really aware that the scar was, as long as it was going to be from hip to hip. And that was a little scary for me. It wasn't the idea of having a scar that long. It was just the idea of being cut that long that was more concerning to me. Because, at my age, the scar really didn't matter to me, but I thought, that's a really big cut. And so I think it really was talking to me that this surgery was, it is a major surgery, but not really, because you don't, and I think that's one of the things you said to me, you don't really go into the abdominal cavity. You're just kind of under the surface of the skin. But those kinds of things were the scary things for me because I had never had surgery before, besides on my knee, which is arthroscopic. So that was kind of something that I had to really take in after that initial talk with you. I remember you all saying affirmations to me like you'd be a really good candidate, and we really hope that you would go through with this because you're the type of person that we feel comfortable doing this procedure on. And so I had to go home and really think on those things. But really what helped me most was when you told me that I was the kind of candidate that was good for abdominoplasty, because I just didn't know. What made me feel better too, because it's very humbling to go in to see a plastic surgeon and then to show someone you don't know well the thing that you like the least about your body. And, I didn't even like my husband to see it, let alone anybody else, the office nurse and you. But it was something that I couldn't do anything about. It was very discouraging when you are someone who's active and you like to go outside and you like to exercise and go to the gym and wear all those cute little outfits, but you're trying to hide this belly that doesn't make sense why you have it because you're at the gym all the time. And I would add that to recover from it, you just have to make yourself get up and go and bend and stretch. And it's super tight as you do go through that with your clients. It is super tight, and it's alarming how tight you can make that abdomen. And I just kept thinking, I've got to keep exercising, stretching, doing yoga, pushing myself so that I don't lose that flexibility. And also I think helps the end result. 6 months out, I think doing all the activities I did made the result a lot better. I felt like I watched each month just firm a little better, just because I was continuing my exercises after the surgery. Right. At 6 months, I was looking at it, and though it's there, it is not as noticeable. It's turning lighter each month. I think the first couple months you think, is it always going to be that deep, rooty red to purple? And now I can see that it is starting to fade, and it's really amazing at 6 months for me now that, there'll probably be a point where I'll look down there and I'll say, boy, it's just a nice, thin, light brown scar. And so it is true. It just seems like so much at the time. It is a long cut. And the other thing I would also bring up, just from recovering from an abdominoplasty, of course, I did not drink enough fluids the first night of surgery, and that was my bad. I think it's because the first day, ladies, you feel great. I mean, thank you. You give us that special medicine in our tummy. You can survive with just Tylenol and ibuprofen. I didn't need any other medications. But because you feel so good, you really need to stay hydrated, because when that wears off and you don't feel good, that's not the time to try to be pushing fluids. So I found myself rather lightheaded hours and hours later than right away. So I would just say, you're going to feel good really after surgery. I mean, and that becomes problematic, because later, when you don't feel as well, because it does wear off, it might have helped that I was taking fluids in then, because I wasn't feeling like drinking or eating too much later. And I think that's what caused me personally to get lightheaded. So that was a bad on me. Oh yeah, it's excellent, and I was surprised how little pain I had, really, and completely manageable with the alternating the ibuprofen and the Tylenol, the whole recovery. So I really like that, because I am not one that likes to take narcotics for anything. I don't like to take medicine at all, quite frankly. So that's something for people to hear, because you might think that's all you're going to give me. That's all you need. You really don't need any more than that. Just drink your fluids.
Yeah, that's good advice. Is there anything else at home that you wish that you had ahead of time, or garments or anything like that?
You know what was kind of a challenge too? I wasn't used to the abdominal binder, and the couple first days after surgery, it does get bloody, because the suture line seeps, and I didn't really have an alternative. And maybe I knew I was going to get a binder, and I was really religious wearing it, because it does, I think, give you better results. And you do have to sleep in it. So, when you only have one and it's kind of got stuff on it, it might want to, you provide one, but you might want to tell them in advance you can go out and get binders, or get something else, because that way when you change it out, you have a second one to put on. I think I could have had that in place before, because it's all I had, and I was trying to be really religious wearing it, but it did get kind of messed up that first day, because it oozes. The site does ooze. And then to be comfortable, I think also with, okay, it does ooze. You've got bandages that could get, bloody. Blood's okay. But it was still scary, because I'm like, is this too much blood? Because, I don't know. And maybe just a little more discussion on, it's going to ooze. It's the way it is. And my bed, like in the morning, that second day, I had to change my sheets. I should have put a blanket down or towels down at night. That first night, I had no idea how much it was going to ooze. And then, we were kind of like panicked. Not panic, that's a bad word, but it's like, oh, I didn't expect this blood on my bed. So, but I do think that providing people affirmations, particularly the ones that are good candidates, if you say they're a good candidate, because you spend a lot of time. I appreciated that. That's one of the things I said to my husband, that you had spent a lot of time that first visit. I'm not used to a physician that spends so much time on that first visit, and I might not even come back. I mean, that was all your time in education, and I could have been someone that said, not for me. But you spent the time that gave me the ability to make, a sound, informed decision. And I think when you said that I'm a really good candidate, it helped me, think, well, I'm a good candidate, and those are the things that make you say, okay, I'm going to proceed because I'm one of those few good candidates, and not everybody, like you said, is a good candidate for this surgery. It's not for everybody. You've got to really work for the results. I think you've got to have a lifestyle to maintain it, and you're getting it for the right reasons. It's not a weight loss solution. It's not about getting skinnier. It's about treating something you couldn't fix with your own hard work. I think that's an important note. It's so it's worth it. I would do it again. And you always said that. And most people, if you Google or internet it, most women say they would do it again. And I would recommend it highly. I would recommend you highly. I thought you made me feel. I always loved coming in to see you. It was always great homecoming week every time I came in to see you. So
that is super, super nice of you. I really appreciate it. And thank you for doing this.